Hi everyone, welcome to the DEWAXIFY series. My name's Sita and I'm a clinical scientist. Today we'll be covering the science behind tinnitus. Have you ever wondered why you hear a ringing in your ears, even when it's silent? Tinnitus is essentially a phantom sound. It's a noise that only you can hear, and it happens when there's a disruption in the auditory pathway. This pathway is the route sound travels from your ear to your brain. Let's break down what's going on in here. Inside your inner ear, we have a part called the cochlea. The cochlea is lined with thousands of tiny hair-like cells, and their job is to detect sounds, vibrations, and convert them into electrical signals. These signals are then sent along the auditory nerve up to your brain, where they are processed into sounds that you can recognize. But with tinnitus, something disturbs this pathway. In many cases, it starts with damage to those tiny hair cells, usually caused by exposure to loud sounds, aging, ear infections, or even certain medications. When hair cells get damaged, they don't work properly and can send random signals to your brain, even when there's no actual sound in the environment. Your brain receives these random signals and interprets them as noise, which we experience as ringing, buzzing, or a hissing sound. Another interesting part of tinnitus involves how our brain adapts to changes in hearing when we lose some sound input. Like in the cases of hearing loss, parts of our brain's auditory system try to turn up the volume to compensate for what's missing. This increased sensitivity can lead to what we call hyperactivity in the brain's auditory centers, creating that phantom sound sensation even when there's silence around us. And here's something surprising. Our brains are incredibly adaptive. Studies have shown that tinnitus can sometimes change over time as the brain continues to adapt. For some people, this hyperactivity decreases naturally, but for others, tinnitus can persist, and that's when treatment options come in. Tinnitus can be complex, and while it's not always curable, there are treatments to help manage it, from sound therapy to hearing aids. If you're experiencing tinnitus, it's always best to see a registered professional for advice and keep watching for more ear health tips. Take care, stay tuned. Thanks for watching. Right at the end of this earwax removal, it's taking off the wax from the sides. There we have a nice clear view of the eardrum. A small bubble there, indicating some congestion behind the eardrum.